everyone. I am Dr. Lewis with Spinal Health and Nutrition. Today, we're going to talk about the differences between Facet syndrome and sciatica. There is a difference. So that's why it's very important that we as chiropractors do a very thorough history to come up with the correct diagnosis of what's going on with the patient. Okay, a very correct history with a very thorough exam. Okay, Facet syndrome and sciatica. There is a difference, but if Facet syndrome is not treated in a timely manner, it will lead to sciatica, okay? So what is Facet syndrome? It's also known as Facet arthrosis. You look at the spine here, throughout the whole spine, from the neck all the way down to the lower back region, there are joints right here called the facet joints for movement of the spine, all right? It aids in bending and extending of the spine, all right? Now, what are the signs and symptoms of Facet syndrome or Facet arthrosis? Pain at the lower back that radiates from the lower back to the buttock region, or it goes down to the back of the leg to the calf muscle. And that usually comes from a couple of things. Arthritic changes around the facet joints due to wear and tear on the lower back, long periods of standing, long periods of sitting, especially some of my truck drivers that come into the office, they're on the road all the time, doing a whole lot of bouncing in those trucks, okay? And what can also lead to Facet syndrome is the wear and tear on the disc. In between the bones on the spine, we have these cushions called the disc, okay? When those cushions wear down, it's going to lead to the facet joints coming close to each other. When those joints become close to each other, it's going to put some pressure on that nerve, leading to that dull, aching pain that will travel down the spine. If it's not addressed in a timely manner, eventually it's going to get worse, and that pain will shoot all the way down the leg to the foot with numbness and tingling. Now, with sciatica is pretty much any type of irritation that's going to affect the sciatic nerve. At the lower part of the spine, there's a long nerve that's very broad that comes out, called the sciatic nerve. It comes out, goes all the way down to the feet. So when there's some type of herniated disc, bulging disc, this is a perfect example of a herniated disc. Once it hits that nerve, it will cause sharp shooting pain. The symptoms of that are numbness, tingling, and also weakness, all right? Like I said, it's important that we do a thorough exam because not only that the sciatic nerve is being irritated by the disc, it can also be irritated by the muscle called the piriformis muscle. The piriformis muscle goes over the sciatic nerve. When there's a spasm on that piriformis muscle, it squeezes that sciatic nerve, and once again, the patient will have sharp shooting pain going down the spine. All right, so I'm going to go through some simple treatments on how to address the facet problem and also the sciatica problem, okay? I'll scan my patient here. Just have a seat right here. I understand you've been dealing with some lower back pain, correct?
Yes, sir.
And how long you been having that problem?
About 3 months.
Okay. Can you remember or recall what triggered it? Were you in some sort of accident, slip and fall, or do you do a lot of sitting at work?
I do a lot of sitting at work.
A lot of sitting at work. Okay. All right. So with the lower back pain that you're having, there's a pain travel from the lower back down the leg.
Yes, sir.
How far does it go down?
Past my calf muscle.
Okay. And it's like a dull, aching type of pain?
Yes, sir.
Okay. Now, do you feel the pain more whenever you go back into extension, when you come back this way?
Yes, sir.
Okay. Now, the reason being is because whenever she goes back into extension, that's going to create more pressure on that sciatic nerve. Now, do you feel some relief whenever you're bending?
Yes.
Because when we bend, that's going to open up the facets, okay? Let me correct myself. The reason why she feels more pain when she goes back, because that's going to put more pressure on the facet joints. Now, she feels some relief going forward because that will open up the facet joints, which will help take some relief off the nerve, okay? All right. So simple techniques that we're going to do. Once again, chiropractic care. Oftentimes when people have these type of symptoms, facet arthrosis, facet syndrome, or sciatica, they want to go get the facet epidural. I'm not knocking that. The only time I'll recommend any type of injections if the patient goes through several weeks of chiropractic care, they've been following a care plan, they've been doing their stretching and nothing helps. If I look at the MRI report and the MRI shows a severe herniated disc or disc degeneration, I'll recommend that with chiropractic treatment. But if the pain level is not that severe, let's say the pain levels are only about a 6, 7, or 8, oftentimes the chiropractic adjustments alone with some stretches will help relieve the problem. All right? Okay, so I'm going to start the chiropractic treatment. All right, once again, if I can have you lay down on your stomach. All right, the first thing I'm going to do is do what we call the chiropractic leg checks. The chiropractic leg checks will help me to see which side of our spine is out of alignment. Is it the right side or the left side? So most of our issues are on the right side. Okay? And the reason how I can tell because the right side of our leg is only a few inches shorter than the left side, which indicates that she has a lot of spasms on the right side and the left side. And whenever there's spasms, tight muscles here and here with tight hamstrings, that's going to draw the hip going up just a little bit, and that can also have an impact on that facet joint. And oftentimes, if there's an issue with the facet joint right here, that joint will be very mobile, okay? So I'm gonna adjust the area that's less mobile, either below it or above it, all right? I'm gonna have you lay down on your side facing me. Actually, lay down on your stomach. Then you're gonna lay down on your side facing me. Okay? You're gonna fold your arms like that. You're gonna slide a little bit closer towards me. Closer towards me, towards me. Yeah, just all right. Okay. Arms. Keep this leg straight. We're gonna bend this knee. Then one thing I like to do is check and see which area is hypermobile or there's a lot of mobility there. Is I move her leg back and forth like that, and I can actually feel the facet joint. Okay, now check this area here, I go above it. That's pretty good. Then I'm gonna go down a little further and go below it. All right, she has less mobility there. So that's the area that I'm gonna concentrate on, okay? All right, put my hand here. Okay, all right, lay down your stomach. Perfect. You can come on up. I see right here. How does that feel?
Good.
Feels good, right?
Better. Yes.
Good. Okay. Simple stretches to do to address the facet problem. Okay. A very simple stretch that you can do is one stretch. You're gonna lay down on your back. Lean back. You're gonna bend both knees like that. Okay. Pull your arms across your chest. And you're gonna simply arch your back up like that. Bring it up. Bring your hips up. Bring your hips up. Yep, there you go. Hold, down. Good. Bring it up again. Down. Okay, perfect. Come up. And down. Now you can do about at least 8, 9, or 10 of these, okay? Another stretch that you can do to address the facet problem, you're gonna sit up for me. Okay? Now I'm gonna show you the stretch you can do. Stand up and show you. See. You can use a yoga mat or a table that's stable. Bring your arms out like that, knees bent, and then simply bring your upper torso back this way, just like that. You're gonna hold that stretch for another 10, maybe 10 or 20 seconds. All right, you can actually feel the facet joints opening up, which will help take some relief on the nerve. It actually feels pretty good. Try that.
Arms here.
Good. And you can feel the joints opening, right?
Yes.
Yes, good. Perfect. Perfect. Okay. You come on up. Stand up for me. You want to do those at least every night. The best time to do is in the morning, because when you wake up in the morning, you're going to feel some stiffness there. So that's the first thing you want to do is those stretches. Another stretch you're going to do is you're going to hold the spine position. Okay, you just come down just like that. Okay, and hold the squat. Arch your back a little bit forward to open up the facets at the bottom. Okay, try that.
I have my hands in front or on the side.
It doesn't matter. You can, whatever is comfortable for you to be able to hold your balance. How is that right there? Feels good?
Yes.
Good. Okay, come on up.
Okay. So how many should I do?
You can do like at least 2 sets of 10 or 20.
Okay.
Okay.
What about here? When you have me going forward and then going backward.
Stay them out, 2 sets of 10 or 20. You use that on the bed, a yoga mat, because you don't want a lot of stress or strain on your knees.
Okay.
Okay? All right.
Thank you, Dr.
No problem. So another condition that I want to address is called sciatica. All right. Sciatica usually comes from tight piriformis muscle, disc herniations, or severe degenerative disc. Okay. Remember, pain will shoot down the leg, numbness or tingling. Sometimes I feel like pins and needles with weakness. Now, when it comes to an issue with the disc, I don't want to make contact on the disc. Because a heated disc, it will cause problems, make it worse. For example, if the patient has a herniated disc at L5, what I like to do is adjust this area right here called the sacrum. All right. So I do my leg checks, my analysis to figure out which direction is the sacrum stuck or restricted. Is it in the upper direction or downward direction? Okay. If it's stuck in a downward direction, then I'll just have the patient lay down on his or her side and do a simple adjustment going up that way to help take some relief off that sciatic nerve. If it's stuck in the upper direction, same thing, make contact on the sacrum base and adjust going in the down direction to help take some relief off of that. Another thing that I like to do after addressing the patient that has sciatica is I do what we call manual disc decompression. So what I do is I get an ice pack, put an ice pack on the heated disc, and I apply a light amount of pressure on a disc, just like that, for one hand here, one hand here, and I apply pressure as though I'm spreading the disc apart. And I'm doing manual disc decompression. I'm basically taking some relief off the nerve by manually stretching out the disc. And I do this for about at least 20 or 30 seconds. And then I take some pressure off of it. And then I do my manual decompression again. Okay? And that will help take some relief off that sciatic nerve. And also, if I want to address the piriformis muscle, have the patient lay down on their side, and I just do some soft tissue work on that piriformis muscle. After that, give them some simple stretching exercises to do. They lay down on their back, bring either the right knee or left knee up to their chest as far as they can. Hold that stretch for 30 or 40 seconds. Same thing with the other knee. Hold that stretch for 30 or 40 seconds. Okay? I'm going to demonstrate this here. You're going to lay down on your stomach. You're going to check. One leg checks. Sacrum base. Sacrum is good on this side. It's stuck on the upper direction. The upper direction on the left side. Okay? I'm going to have you lay down on your side facing me. That. Slide closer to my knee. Keep these legs straight. That's me. Okay, come on up. Okay. All right, so I did the adjustment. The next thing we're gonna do is gonna show you all how to do some soft tissue work on the piriformis muscle. Okay. All right, I'm gonna have you lay down on your side facing down. I'm gonna be standing over you on your side facing me. Yes. Okay, so the piriformis muscle is located right along here. Okay, go from here to here. And once that muscle is very tight, or there's a spasm there, it puts pressure on that nerve. So what I'm gonna do is I'm gonna bend her knee, just like that. I'm gonna make a fist and just go dig deep in there. Do that for about 10 or 15 seconds. And then I'm going to there you go. Good. I'm gonna do some soft tissue release on the piriformis muscle. I'm also gonna break up some scar tissue here on that same muscle area by just simply making a fist on that piriformis muscle and just moving her leg back and forth just like that. Good. How's that?
Feels
That
good.
feels good, right?
Yes.
Perfect. Okay. Come on up. Good.
Oh,
Yeah. Simple stretching exercise to do if someone has sciatica or sciatica with some radiculopathy. Same amount of stretches here. I'm going to have you lay down your back once again. Okay. Bring both knees up to your chest. Put your hands around your leg. Bring your knees up to your chest as far as you can. You're going to feel that stretch, all right?
yes.
Okay. So you're going to hold that stretch for about 20 or 30 seconds. Okay. All right. Good. Okay. Perfect. Bring both legs out. Good. Okay. All right. And the last thing I forgot to show this technique here, this pumping. You're gonna lay down your stomach for me.
Okay.
So she has a herniated disc at L5S1. So I don't want to do any type of heavy manipulation on the disc. It's going to cause the area to flare up. So I'm simply going to put one hand here, one hand on the sacral base. The other hand is going to be between L4, L3, and it's simply just spread the tissues apart like that, but naturally decompressing the disc. So exercise that she's going to do at home are the stretches. Also, ice it down every night for about 20 minutes. Ice it again in the morning, okay? Because if you have sciatica, the first thing you're going to notice when you wake up in the morning is some stiffness there around the area, all right? Very simple technique for sciatica, very simple adjusting technique for Facet syndrome or Facet arthrosis. I'm Dr. Lewis. Please like, subscribe, share to our YouTube channel. And remember, your health is your greatest investment.